Hello everyone, this is Bob Browner with Community Coronavirus Update number 75. Themes today, we'll talk about ways we could go right or wrong in the coming months and some of my best ideas of why Lincoln likely got it right with some numbers behind that. So best news of the week is that Pfizer vaccine is now being approved for ages 12 to 15 and likely shots in arms later this week. And so this is a huge development because this gives us the way to get to herd immunity in the middle and high school age ranges such that we could potentially start school in August this year for middle and high school in a normal way. So I think this is really good news for all of us. Nationally, some good news in that numbers are falling across the board nationally. We only have one red state left, Michigan, and it looks like they might exit that fairly soon. You got more yellow coming across the country. Hopefully, we'll hit some green soon. Nebraska actually was down to yellow for a day or two, but unfortunately back up to red again or orange again, which I'll talk about in a few minutes. The theme for today, getting it wrong versus getting it right. And I actually think there's three possible scenarios going forward. One, we follow the path of Israel and UK, which would be awesome. Unfortunately, that means we have to do what they did, which may not be happening in the United States across the country. Number two is we have sporadic regional outbreaks. Some of us follow the science and data, and some follow ideology and wishful thinking. And I think this is the most likely scenario, unfortunately, and I'll explain why in a minute. The worst case scenario, unfortunately, is that we get a new variant and we start over again, and that is a possibility, unfortunately. So let's take a look at that. So if you look at United Kingdom and Israel, they've done probably among the best in the world on vaccinations, plus maintaining the right metrics in place so they could get things under control. The key is to follow the numbers. And if you look, you've got Israel at 0.47 per 100,000 and UK at 3.43 per 100,000. So very, very low rates. And they keep pushing them back down, which is great to see. United States, we're kind of following them, but we're not there yet. We're at 11.5, so we're not where they are yet. And unfortunately, we're not always doing what they did. And so last week we talked about this Vox article about Israel, the things they're doing. One, they're still maintaining some masking and capacity requirements for indoor venues, and they have a green pass to incentivize vaccination. We have places in the United States that are doing this, Hawaii and New York, for example, but we have some people who are specifically not doing this, and this is the problem, and that's why I think scenario one is the unlikely scenario. I think scenario two is the likely scenario. And so I think we're going to have sporadic regional outbreaks because some of us will follow the science and data and some of us will follow ideology and wishful thinking. And public health doesn't care about your ideology and wishful thinking. Well, actually not public health, but the virus does not care about your ideology and wishful thinking. It's going to act how it's going to act and you need to respond accordingly. So 2 weeks ago, I showed this map and it was looking really good. It's harder to control pandemics in an urban center. So that's why the Lincoln and Omaha hadn't gotten as good as the rest of the state. Unfortunately, the rest of the state started letting up their restrictions too fast. So a lot of cities got rid of their mask ordinance. A lot of schools got rid of their mask requirements. And guess what happened 2 weeks later? Well, Lincoln's number has been going down, but I have a couple health inspections who are going back up again. And so they weren't following the science and they gave up too soon, unfortunately. We've added a new a visual on our healthynebraska.org website. What we did, this is the CDC thresholds for schools to assess risk of community spread and to inform schools. They have a little bit different metric and a little bit different color scheme, but we added this because this is what the CDC has right now. So Lincoln, Lancaster County, the good news is we're getting numbers down almost to the yellow range, but I think without mass is probably more like a blue range. We're not there yet, but I could see us getting there, which would be great. If we use the same metric and we look at Grand Island, Hastings, Nebraska, which is Adams and Hall County, they were down here, but unfortunately numbers lately are heading back up again. Same with the North Platte area. So Lincoln County is actually North Platte, not Lincoln, not the city of Lincoln. But they went up a little bit over Easter, back down again, but now they're heading back up again. And so I'm worried that we're going to start seeing this across Nebraska because a lot of school districts and cities got rid of their mask requirements. So you can take off masks when most in a room are vaccinated and not until then. Unfortunately, I think this is the big mistake people are making. They're taking their masks off in a room full of unvaccinated people, and guess what? It spreads. So you need to follow your vaccination rate, and this is the visual from our Lincoln Lancaster County Health Department, which I really like now. They've actually added visuals for both 1% of population that's had at least one shot and percent that's completely vaccinated. So this can be your sort of leading indicator where you're heading to. We now have 2/3 of Lincoln's adults with at least one shot, and so we're getting there in Lincoln, which is really great to see. But we got to start looking about these younger kids because you have to get it a whole population that includes the young kids. Hopefully, we'll add a 12 to 15 age group next week, and we'll hopefully start seeing that up. But really, we need to get, we see, in 70 to 80% vaccinated before we start throwing all of our masks across the community. And then, the rest of the state's not there because Lincoln has the best vaccination rate. So we know the rest of the state is actually much lower. So getting it wrong, the new variant, we start over again. That's what worries me the most, and I think what keeps a lot of public health people up at night. So some good news is this study from the New England Journal about the Pfizer vaccine with some of the new variants. And so this is the Pfizer vaccine versus B117, which was the UK first identified in UK, and B1351, which is first identified in South Africa. And the good news, B117, this is the one that's spreading in Nebraska right now. The Pfizer vaccine was still 90% effective against any infection and still almost 100% effective against dead or in the hospital, essentially. And so this is really good to see that the Pfizer is still helpful against the B117 that's spreading in Nebraska right now. This is a much more infectious variant and maybe even worse in young people, unfortunately. The big worry, though, is what's going on in India right now. And India has another variant. We don't know how good the vaccines are against this new variant. It's already spread to over 50 countries. So we need to do anything we can to keep this out of our country and keep it spreading around. And especially until we know whether our vaccines work against it or not. And so this is, I guess, what I would call the nightmare scenario. We could be starting over again. We don't want that. Again, at the end of the day, really it's dead versus not dead. And so I keep using this. Basically, what I do is I pull directly from the Johns Hopkins website what the number, what portion of your population died from coronavirus. That tells you how good your response was. India is really messed it up. Brazil, also, you're probably aware of that. They blew past not only the United States mortality, but even the United Kingdom's. And so we need to start looking to who did it right. Countries like Norway and Japan, and follow what they did. Here in Nebraska, it's also we've taken the same numbers and broken it down not just on a state level, but at a region of Nebraska level. I'm using Maine as one of our best say scenarios. I don't Hawaii is a little lower, but Hawaii, they're an island nation. It's easier to control spread. We're an island nation, whereas Maine is not. Lincoln almost did as well as Maine for mortality rate. Omaha did a little better than the rest of the state, but not as good as Lincoln. I think that's because they weren't able to set their own directive health measures like we were. Rural Nebraska did worse, but luckily not as bad as Kansas, Iowa, and South Dakota as far as how many people died. So how did Lincoln get it right? This is one of, so I've got I think really it comes back to two factors about what Lincoln did right versus other folks. Number one is we were first to get a good setup for our schools. And so there was a movement amongst the medical community to really support our schools and making the right decision and starting with masks in August. And so in June, all of the state medical societies, Academy of Pediatrics, State Medical Association, Nebraska Academy of Family Physicians, our local county medical society, and over 125 Lincoln physicians signed on to this recommendation for our school board to start with masks. And so thankful for people like Steve Williams from Nebraska Academy of Family Physicians supporting our decision to wear masks. Same letter from Dr. Cindy Ellis, Nebraska Chapter American Pediatrics. You'll notice the few local folks on that board of directors again saying, hey, we need to have masks in schools. And so I think one of the biggest reasons we did so well is we started it right in the right way in schools. And it wasn't just Lincoln, a lot of other regional school districts did the same thing. And so one thing that it was sort of a balance there. And so here's an interesting visual of the lost attendance in schools per county. And you'll notice in the middle of the country, we did a great job getting our kids in school, way better than the coasts. But in Nebraska, not only did we get kids in our schools, we also didn't kill a lot of people like some of these other surrounding states. So I think we maintained a nice healthy balance. Part of it was we got our schools and a lot of other school districts, not just Lincoln, Omaha, Grand Island, also adopted some of these really good recommendations. So they got their kids back in schools, but they did it in a safe way. The other thing that I think helped Lincoln is that our health department was able to follow its own directive health measures based on the science, and they started them pretty quickly. So in July of 19th last summer, they put in a city mask ordinance. They were the first in the state to do so. There was a lot of pushback on this, and they caught a lot of flack, but it was the right thing to do. And when it got worse, they strengthened it. And so in November, when things were taking off, they put in a stronger mask ordinance and did some other things on capacity limits that others were not allowed to do. And so I think the combination of getting it right in schools and getting it right as a health department and city meant we were able to keep people alive and slow spread in Lincoln. And not only that, we also maintained our hospital capacity. And so that was important. And this from our health department, when they tracked the hospitalization rate, The blue is the number of Lincoln Lancaster County residents that are taking care of our hospital. The orange is people from all around. So not only were we able to maintain capacity so we could take care of our own people, we actually took care of a lot of other counties' people that didn't do as well. And so I think that helped keep the mortality rate down, not just for Lincoln, but around, because we were able to maintain good medical care. We did not completely overwhelm our hospitals. We acted soon enough, and I think it made a difference. A little concerned lately that our hospitalizations are going up a little bit, probably because this B117 variant, when it affects younger people, seems to be having a lot of higher um, hospitalization rate. Of course, though, still nothing like here, fortunately. But not only did we maintain and do a good job of preventing spread of coronavirus, we also did a great job with our economy. And so this is the untold story I think we need to start touting more. And so here's an article from Wallet Hub about the cities that had the fastest bounce back from unemployment rates. And guess who's number one? Lincoln, Nebraska. And so not only did we keep rates of coronavirus spread low, not only did we save a lot of lives, we also protected our economy because we kept things safe so people were able to get out and spend. We can get out and do things with more confidence because we kept our rates low. And so one of my biggest frustrations, it's not public health versus the economy. This was a false decision that was pushed out for political reasons. It's public health to get the economy back on track as soon as possible. And I think Lincoln did it better than others, and I think we've got the data to back it up. So, good news then. I've been vaccinated. There's good news as far as safety for outside. This is me at the farmer's market a week and a half ago. So if you're in an outdoor space like this, I think it's plenty safe. If you're vaccinated, you can maintain your 3 to 6 feet of distance. I don't think you need masks when you're out doing things like this. Now, if you get closer, let's say you're in a concert or a crowded football game, if you're around a lot of other people you don't know and you don't know their vaccination status, you might want to throw your mask, or you should throw your mask back on. But we have a lot more we can do. It's a lot safer, and thankfully we've got vaccination. So when you make your own decisions, again, keep using this calculus. I run through a lot. That's vaccines plus mass plus distance plus ventilation, the time you're there, and the community risk around you. Use these to help you figure out when do I need to wear a mask based on my own healthcare condition. And hopefully this will give you some guidance to go by. One last thing I want to talk about. We produced 75 episodes. We do this for free. So Ted, Mary Jo, and I, our Tableau site, we do this on the side. And so I've not monetized this YouTube video in any way, so because I want it to spread as much as possible. So on episode number 75, we would like to make one ask is that you make a voluntary donation to healthylincoln.org at the Give to Lincoln Day, which is through the month of May. So please go to givelincoln.com. I also put a link in the notes section. If you think this YouTube series has been helpful to you, please just donate what you can. We'll put that money to the maternal child health projects that we're going to start working on as soon as we can get done with the coronavirus. We're hoping to pivot to that in the next few months if we get things under control. So again, hope this is all helpful to you. The past episodes here on healthylincoln.org. Here's the places I work with and for, but the disclaimer that these are my opinions, not necessarily everybody else. And go out and get your vaccine and be safe out there. Thanks.